Hello, I'm Damon Reed. I'm chair of the Department of Individualized Cancer Management and also in the Sarcoma Department at Moffitt Cancer Center. And I'm presenting here at ASCO 2023 in my poster regarding a trial called PEPN 1924. And in this trial, we're looking at a rare tumor called osteosarcoma and looking at an agent that has called Enhertu that has wonderful activity in breast cancer. And it works specifically by binding to a protein called HER2 that is critical and involved in lots of breast cancer patients. Well, osteosarcoma has HER2 as well, and so we were working on both figuring out how many osteosarcomas have this and trying to see if this agent would also be able to deliver chemotherapy and affect osteosarcoma in a positive way. And so we first had to screen patients to figure out if they had HER2 positivity in osteosarcoma. And what we found was in an assay that we had to build specifically for osteosarcoma that many did. And so we were expecting about 40% of patients having HER2 expression, but we found it in about 80%. And so this was good and promising for this agent. And so while this is a rare tumor, we had lots of patients that wanted to go on this trial. We were able to put on 9 very quickly, and we wanted to see if there was some activity before we put on more patients. And so the unfortunate part about this was it's a great drug. The trial was run very smoothly, but unfortunately only one of the 9 patients were seen as having any benefit. That person had their disease stay stable for about 9 months. The other patients had their disease progress shortly after starting the agent. And so what we determined is that HER2 is expressed in osteosarcoma, but maybe not in a way that's perfectly druggable. And so we're looking at some of the correlative studies to try to see how much of this agent got into patients and trying to see if there's any biology that we can determine from the tumors to try to see why that one patient responded and see if we could do this in a smarter way. But at this time, we're not expanding this trial to put on any more patients with osteosarcoma. This trial was conducted with NIH funding and through the Clinical Trials Evaluation Program and the Early Phase Trials Network and the Children's Oncology Group. And it's been a pleasure to be the study chair for this and work so hard for the patients. Obviously, thanks to the company who supplied the agent, and there was a huge team involved in the biology and the screening for these patients.